Hello everyone, and welcome to our pelvic floor training session. In this presentation, we'll explore the fundamentals of pelvic floor function, common diagnoses, treatment approaches, and more. The pelvic floor plays a vital role in our clients' lives, allowing them to participate in the activities, routines, and hobbies that they love. Understanding how to assess and treat pelvic floor dysfunction can make a profound impact in their well-being and quality of life. This presentation is based on the knowledge and information gained from the OT Pioneer certification. Additionally, a few research articles have been sourced from various reputable references, which will be cited throughout the presentation. This presentation's objectives include to identify the anatomy, purpose, and function of the pelvic floor, recognize common pelvic floor disorders, gain knowledge of the various treatment strategies for pelvic floor dysfunction, understand the importance of interdisciplinary collaboration in pelvic floor rehabilitation. The pelvic floor is a group of muscles and connective tissues that perform elimination, organ protection, and help individuals engage in intimacy. For optimal function, it is essential that we can fully contract and relax the pelvic floor muscles, allowing for a complete range of motion and ensuring proper coordination, flexibility, and control of the pelvic floor. The pelvic floor consists of connective tissues, nerves, ligaments, and 14 muscles, including the levator ani group, which support and power the pelvic organs. The pelvic floor rests between four important landmarks that create a diamond-like shape: the pubic bone, the tailbone, and the sits bones or ischial tuberosities, which are round-like bones near the hip joints. The pelvic floor inner core team includes the pelvic floor, respiratory diaphragm, multifidus, and transverse abdominis. These work together to manage intra-abdominal pressure for internal organ protection, core stability, and promotes proper pelvic floor function. It is important that during movement and activity, we exhale during exertion to properly manage abdominal pressure, preventing unnecessary strain and pressure on the bladder that may lead to leakage. The pelvic floor has three layers, including the superficial, middle, and deep layer. The superficial layer consists of the bulbospongiosus, ischiocavernosus, and superficial transverse perineal muscles, which aid in organ protection and continence. The middle layer is comprised of the deep transverse perineal muscles and the external urethral sphincter, which make up the urogenital diaphragm and contribute to continence. Finally, the deep layer includes the levator ani group and coccygeus muscles, which make up the pelvic diaphragm, support the external genitalia, and assist in anal canal closure. The accessory muscles that play a role in pelvic floor support include the glutes, hip flexors, hamstrings, piriformis adductors, and latissimus dorsi. These muscles work in synergy with the pelvic floor to maintain postural alignment and enhance coordination to promote pelvic stability, core stability, regulate intra-abdominal pressure, and contribute to optimal bladder and bowel function. Pelvic floor rehabilitation can address a range of conditions and concerns that significantly impact one's life. Some common diagnoses that may be treated in pelvic floor therapy include stress urinary incontinence. This is involuntary leakage of urine during activities that may cause bladder pressure. Common activities that may trigger stress urinary incontinence include running or jumping, coughing or sneezing, lifting heavy objects, and or walking on an incline such as curbs or steps. This diagnosis is often linked to a weakened pelvic floor. Secondly, urge incontinence or overactive bladder is characterized as strong, intense urge to void leading to leakage. The bladder begins to contract because of specific stimuli, which can include running water, positional changes, hormonal changes, bladder irritants, lifestyle factors, and more. Thirdly, pelvic organ prolapse results in a change in the position of the pelvic organs, resulting in changes to sensation, structure, and function. This is often the result of a weakened pelvic floor, and many clients may describe this feeling as pressure, heavy, even like a rock. Finally, chronic pelvic pain is persistent pain, longer than 6 months, in the pelvic space, often interfering with daily activities and quality of life. This pain can arise from various causes, including endometriosis, post-surgical procedures, peripheral nerve involvement, and other underlying conditions. In pelvic floor therapy, the client has the autonomy to choose their preferred evaluation method. It is critical that we provide a clear and thorough explanation of the process, ensuring the client can give informed consent while feeling comfortable and safe throughout the evaluation. By empowering clients to participate and advocate for themselves, we help align their care with their personal therapeutic goals. Remember, it is important to exhibit ongoing communication throughout the assessment process, explaining each step, its purpose, and checking in with the client to foster trust and comfort, as well as to establish a collaborative approach to therapy. Pelvic floor assessments help to evaluate the client's muscular coordination, range of motion, tone, strength, skin integrity, and function. Clients may choose from the following 4 options. Feedback-based assessment. This assessment focuses on the sensation, feelings, and experiences reported by the client. It is completely non-contact with a focus on verbal feedback, posture, breathing patterns, body movements, and mechanics. The non-contact exam is an in-depth visual assessment to gather information on external alignment and appearance. The therapist may assess skin integrity and external muscular activation. The external exam is a hands-on physical assessment of the external pelvic floor features to assess muscle tone, coordination, symmetry, pain, and appearance. The therapist may palpate the abdomen, glutes, perineum, as well as the vulva. The internal exam is a hands-on physical assessment of the external and internal pelvic floor features to assess muscle tone, coordination, symmetry, pain, and appearance. There are several effective treatment options to improve pelvic floor function, including pelvic floor muscle exercises, or PFME, biofeedback, and electrical stimulation. These interventions enhance muscle strength, coordination, and pelvic health. PFME focuses on increasing the range of motion and control of the pelvic floor muscles through exercise. These exercises begin with improving muscle activation and flexibility, followed by targeted strengthening to enable contraction and relaxation within the pelvic floor. Biofeedback is a technique that utilizes electronic sensors to monitor muscle activity, providing visual feedback to the client to enhance body awareness. The primary use of biofeedback in pelvic floor is to distinguish between abdominal and pelvic floor muscle contractions. The client and therapist may use biofeedback during activities such as bearing down, which simulates elimination, or practicing isolating the pelvic floor muscle contractions. This tool allows us to gather insight into which muscles are firing and engaged to promote optimal pelvic floor function. Electrical stimulation involves using therapeutic electrical currents to activate specific pelvic floor muscles to improve function and coordination in those who may have difficulty voluntarily contracting these muscles. Electrical stimulation aids in reestablishing those neural connections, making it a valuable tool for those recovering from strokes, traumatic brain injuries, childbirth, post-surgical, and other various conditions. Dilators. This is a therapeutic tool used to improve flexibility and blood flow of the pelvic floor muscles and surrounding tissues. It can aid in decreasing pain during activities such as intimacy and tampon insertion by desensitizing hypersensitive areas through gradual exposure to stimulus. Dilators are often utilized in conjunction with nervous system regulation and relaxation strategies such as deep breathing and mindfulness. Manual therapy. This is a hands-on technique performed by trained healthcare providers to release muscle tension, improve blood circulation, and mobility for improved pelvic floor function during daily tasks. Some examples of manual therapies include myofascial release, trigger point therapy, and joint mobilization. Behavioral therapy. This intervention works to identify and implement strategies to modify behaviors, habits, and routines that may contribute to pelvic floor dysfunction and pain. Examples include bladder training, relaxation techniques to help regulate the nervous system, posture, and breathing patterns. The primary care physician serves as the central point of communication among the client's healthcare providers, recognizing symptoms of pelvic floor dysfunction and facilitating appropriate referrals for pelvic floor rehabilitation. Occupational therapists focus on improving functional performance in daily activities and routines, incorporating a holistic, client-centered approach that addresses both the physical and psychosocial components. Physical therapists specialize in musculoskeletal function, posture, and body mechanics to improve pelvic floor performance. Physical therapists utilize manual techniques, movement retraining, and therapeutic exercise to improve pelvic floor function and mobility. Urologists and gynecologists offer medical assessments and diagnoses for pelvic floor dysfunction. Their management approach may include medications, surgical interventions, and referrals for pelvic floor therapy. Mental health therapists or psychologists aid the client in stress management to promote emotional well-being. This may include cognitive behavioral therapy, relaxation techniques, identification of coping mechanisms, and various strategies to promote overall well-being. Here are some interesting facts on pelvic floor disorders. According to Axelrod and Vestal 2021, 1 in 3 women in the United States experience a pelvic floor disorder. Research further indicates that this number is expected to double by the year 2050. Pelvic floor disorders are not just a women's health concern. Research by Thesey 2023 shows that 32% of women and 16% of men will experience a pelvic floor disorder at some point in their life. The impact of chronic pelvic pain extends beyond solely physical discomfort. It also significantly affects mental health. Research by Scott et al. 2022 indicates that depression occurs in 26% to 52% of individuals with chronic pelvic pain, compared to just 5% to 10% in the general population. Anxiety is also far more prevalent, affecting 39% to 73% of those with chronic pelvic pain, while the rate in the general population is only 12%. Here are some myths on pelvic floor dysfunction. Pelvic floor dysfunction is a normal part of aging, and pelvic floor dysfunction is a normal part of having children. Finally, there's nothing we can do. We simply must put up with it. Here are some facts on pelvic floor dysfunction. Pelvic dysfunction is treatable. It is important to see a holistic pelvic floor therapist. Pelvic floor dysfunction can impact every occupation or daily activity you engage in. Finally, half of all women experience some degree of pelvic organ support loss. Now that we have learned more about the key concepts of pelvic floor rehabilitation, let's take a moment to go through some common questions. How can diet and lifestyle play a role in pelvic floor health? Diet and lifestyle play a crucial role in maintaining a healthy pelvic floor. Proper nutrition, hydration, and daily habits can support gut health, reduce strain, and promote optimal muscle function. Here are some key recommendations. Fiber intake. Consuming enough fiber is essential for smooth and regular bowel movements, reducing strain on the pelvic floor. According to Vestal 2025, men should aim for 38 grams of fiber daily, while women should consume 25 grams of fiber daily. Hydration. Drinking half of your body weight in ounces of water throughout the day helps maintain bladder health. To prevent irritation, it is important to limit bladder irritants such as caffeine, alcohol, artificial sweeteners, and highly acidic or spicy foods, as they can disrupt the bladder's pH level. Conditions like irritable bowel syndrome or IBS and small intestinal bacterial overgrowth can contribute to pelvic floor dysfunction. Keeping a food journal or identifying trigger foods can help manage symptoms and minimize discomfort. Regular physical activity and stress reduction techniques such as deep breathing or mindfulness support core strength, posture, muscle function, and tension release, all of which contribute to pelvic floor health. Monitoring bathroom habits can provide insight into pelvic floor function. Normal urination frequency is 6 to 8 times per day or every 2 to 4 hours. Bowel movements typically range from 3 times per day to 3 times per week. It's important to avoid straining to prevent unnecessary pelvic floor pressure. Another common question is, when should I implement and prioritize downtraining versus strengthening? Following the evaluation, you will gather key insights into the client's coordination, muscle symmetry, skin integrity, strength, and range of motion. If the client presents with an overactive pelvic floor characterized by excessive tension, breath holding, increased abdominal activation, pelvic pain, difficulty with elimination, or a history of trauma, downtraining should be the initial focus of therapy. On the other hand, if the client exhibits signs of a weakened pelvic floor, such as prolapse, stress incontinence, or hypotonicity, strengthening exercises should take priority. That wraps up our presentation on pelvic floor rehabilitation. Thank you for taking the time to listen and expand your knowledge in this important and prevalent practice area. For further information, here are the references used in this presentation. Thank you.